Our project aims to visualize and analyze accessibility and connectivity throughout San Francisco by examining three main tools of accessibility: bus stops, grocery stores and farmers market, and healthcare services for the urban poor. Thus, this project asks, where are the areas of need to improve accessibility within the city of San Francisco? Why did we choose San Francisco? The urban focus of our research is critical to the scope. We will only be looking at the city of San Francisco rather than the larger Bay Area. While San Francisco tends to rate better than surrounding counties in terms of availability of services, availability still does not translate into accessibility. The growing numbers of food-insecure low-income populations that lack access to healthcare services and public transportation reveals that San Francisco is a good example of a city with a dysfunctional urban system. Thus, this project aims really to establish mapping opportunities that connect public transportation, urban food system, and healthcare services. Thus, the main idea of the Access to Access project resonates in adopting the accessibility concept. And here comes our first map, San Francisco, as a base map of our three main data sets that we will use throughout our analysis. Maps shall define the accessibility status by considering health indicators such as income, access to healthy food, and this is identified by grocery stores that accepts EBT. Additionally, we're considering public transportation, especially the Muni, and healthcare sites. Maps will then highlight the relationships between access, health, and wealth. Based on these relationships, we will give an accessibility score to different parts of the city. These scores will reflect the level of ease in accessing food and healthcare sites via walking.
For our analysis, to understand the accessibility of low-income San Francisco residents, we are primarily focusing on whether these individuals have access to healthy food options and healthcare within walking distance. To do this, we are analyzing the distances from these facilities up to 1 mile in quarter-mile increments. We are also analyzing the walking distance to the nearest Muni bus stop. Areas that are farther than 1/2 mile away from these locations are in need of improved accessibility and services. There are portions of the city that have low accessibility to daily necessities such as food sites, healthcare sites, and transit sites. These portions of the city also tend to be home to the most impoverished residents, those who must use EBT or food stamps, and those who must use Medi-Cal or California's version of Medicaid. These areas are more than a 1/2 mile walking distance from these sites, and we can see them more concentrated in the southeast and southwest portions of the city. Walking 1/2 mile for groceries, access to transportation, and regular doctor's visits for a young, healthy person is not necessarily burdensome. However, impoverished San Franciscans have higher rates of chronic diseases such as heart disease, hypertension, diabetes, and asthma. These health conditions, determined by socioeconomic status, make accessibility even harder. There are areas of the city with a large proportion of residents living in poverty that also have high levels of accessibility on all three of our measures, such as the downtown area and SoMa. However, the southeast and southwest portions of the city with a similarly impoverished population are lacking in accessibility for food and healthcare sites. These are the areas we have identified as in need of improved accessibility. We also analyzed the square acreage for the areas of the city that are more than 1/2 mile walking distance for each of our three measures. Compared to the square acreage of census tracts, where 30% or more of the population lives below the poverty level, we can see that accessibility is not just a problem for the urban poor. Accessibility can be improved for all San Franciscans.